Hi guys, my name's Clarky. Nathan is my physio and we're going to do a series on my ACL injury, surgery, recovery, everything that goes with that. So as a child I was a swimmer and then mainly just school sport. Once I graduated university I started playing soccer in 2015 and I also played volleyball and netball socially on and off.
Yeah, okay, cool. So how did your ACL injury happen?
So a Tuesday night in late April, I was at soccer training. I jumped over a stationary ball, landed on both my feet. My right knee clicked in and then it clicked out and I ended up on the ground.
Yeah, okay. So what happened over the next few days?
So for the next couple of days, I couldn't bear all that much weight on it. So I went to my GP the day after the incident, got a referral to go and get an MRI, which happened the following day. So then on the Friday, which was the next day, I received my results that I had completely ruptured my ACL. I had a grade 1 tear in my MCL, I had bone bruising, and I strained the muscle as well.
Yeah, okay. So what were your thoughts on that?
I was very surprised because I didn't initially think I'd done that much damage to it. I thought that I had maybe done something to my MCL, but I didn't think the ACL had been affected.
Yeah, okay. And then so we had a few other issues towards the end of the week. So can you talk what happened after?
So the Friday night, which was the same day I received my results, I walked up the stairs with my partner to go to bed because my ankle and my calf were quite sore and tense. Got to the top of the stairs, walked into our bedroom and instantly felt extremely nauseous. Asked my partner to go and get a bucket. By the time I had the bucket in my hands, I was very, very dizzy and was sitting on our bed. I proceeded to pass out 4 occasions. My partner then rang the ambulance. They turned up within about 10 to 15 minutes. About 6 hours later in emergency, despite all of the doctors and nurses being sure that it wasn't going to happen, I was found via a CTPA to have multiple, so over 5 pulmonary embolisms.
And so what did they do to manage that?
So I went on to a course of blood thinners, so in particular Xarelto, which is just an oral blood thinner. However, because of that, no surgeon would touch me in regards to my ACL.
Yeah, okay. And so we had a few discussions around sort of surgical and non-surgical options. What are your thoughts on those two different approaches to managing ACLs?
They both have their pros and cons. For anyone who's kind of wanting to avoid surgery in general, then your non-surgical route definitely has its benefits and it's definitely doable. I, however, come from a family of highly involved medical professionals, so I had that always in the back of my mind that they were overly confident that surgery was the way to go, and I knew that I had the support network around me to be able to do that.
Yeah, okay. So why did you opt for surgery? Were there any major reasons outside of those family influences?
I had a mental block that in my head I had no ACL, which meant that my knee was never going to feel as stable to me as it should without having that surgery. Throughout the course of trying to make that decision, I just didn't feel stable on my knee. There was a few occasions where it felt loose and really uncomfortable and it just didn't seem to be progressing as fast as I thought that it would.
Yeah. Do you feel the pulmonary embolisms and all the effects from that potentially sort of slowed down your recovery?
Without a doubt. I spent at least a month being told that I wasn't allowed to put any weight, any pressure on my knee, which obviously the muscles in that time just deteriorated very, very quickly. Mm-hmm. So yeah, that was a big impact, that just no muscle whatsoever.
So we did a lot of pre-op physio. What are your thoughts on the benefits of it? What did you think of that whole experience? Do you think it works well for people who are looking at that surgical option to do beforehand?
It definitely had a huge benefit. When I went to see my surgeon, once I was cleared for surgery by my haematologist, he wanted that knee as straight as humanly possible. Without the physio, that would have taken an extremely long time if it had happened at all. Yes, it was painful as all hell, but it did progressively not become as painful as it became straighter. The exercises that I was given became easier and easier to do as that knee became straighter and straighter. I was able to increase the time that I was holding exercises for and the reps that I was doing. The knee feels pretty good now after surgery, and I think knowing that I had that ability beforehand is making me a little bit more confident now.
Yeah, okay. So where are you at with everything now? So you've just had the surgery. Where's your head at with your recovery at the moment?
It's pretty good. I can do most things that I'm being asked to do, so that's good. We have a follow-up appointment with my surgeon on Monday to find out how we are progressing and if I can get out of the brace.
Yeah, okay, cool. So I might check in again, and we'll do another video just after you see the surgeon. So I'll check in, see what he said, and see where we go forwards from here.
Yeah, do.
Perfect. See you guys.